Checking, checking. 1, 2, 3. We are here to do head to toe assessments. We're getting started. Hey, how you doing today?
Good, how are you?
I'm doing good. My name is Nathan. I'll be doing a head to toe assessment for you provided by the doctor. Is that okay with you?
That's fine.
All right, good. What I'm going to do first is I'm going to wash my hands, provide privacy. And before we get started, I want to first ask you for your name, date of birth, and while you tell me, I would like to check your wristband if you don't mind. While you tell me, what's your name and date of birth?
Jordan Shackelford, 5/20/97.
Okay, good. Thank you. And I just have a couple questions for you. Do you know where you are?
Yes.
Do you know what day it is?
It's Friday.
Okay. And do you know why you're here?
For a physical exam.
Okay. AO times 4 there. Aware, alert, awake oriented. Everything seems to be very compatible and cognitive. Okay. Thank you. Now, before we get started on anything else, I first just want to make sure that your head doesn't have any lice, abrasion, no kind of swelling, edema. Well, that's okay with you?
That's fine.
All right, let's check there. All right, see here. Face equally symmetrical as well. The face is equally symmetrical as well. Also, she doesn't have any lice, no abrasions, no edema. Everything's symmetrically equal. So we're going to go ahead and chart that down real fast. Chart. Now that we got that, the next thing that we're going to do is we're going to do eyes for symmetry. We're going to do it for Perla. Make sure that they both constrict, dilate equally. So if you don't mind, if you could just take a look. Here we go. Are you ready? Just take a look at me. Okay, and I want you to just follow this pen for me. Nice. So what we just have here, everything's equally dilating, constricting, meaning that she does have Perla, which is good. Pupils equal, round, reacted to light and accommodation. So we're going to go ahead and chart that. Chart. And now the next thing that we're going to do is we're going to do sinuses for patency, for good patency. So what we're going to do with that is I first want you to take your finger and put it on one of the nares, and I want you to breathe for me. Okay, and may you please do it for the other nostril for me, please. Okay, good breathing. Doesn't sound like no excess mucus going on there, no excess mucosa, but we're not done yet. We're going to first take a look at the nares. All right, everything's pink and intact. No signs of excess drainage. So we're going to go ahead and chart with that. Now what we're going to do next is we're going to inspect the mouth, oral mucosa, gums, teeth, just to make sure everything's intact. No kind of swelling inside, no edema or anything of that nature. No cyanotic activities going on, no abnormalities. All right, so what I want you to do for me is just say ah for me. All right, open a little wider for me, please. Yeah. Can you stick your tongue out for me, please? All right, now what I'm going to do is I'm going to look in real quick just to make sure. Yes. Everything's pink and intact. And moist. No swelling. Tongue is good. May I see your teeth, please? Smile for me. Just like that. That's a beautiful smile. And you can see, yes, your gums, everything. Yes, teeth are strong. Gums are pink, moist, intact. Mucosa, oral mucosa, no excess salivary things going on there. So we're going to go ahead and chart that. Chart. No signs of edema, no signs of anything of that nature. Looks like you're getting good oxygen through there. Otherwise, it would have been a different color. All right, so now we're going to look at the neck. Now, what we're going to do with the neck is we're going to palpate for the lymph nodes because we want to check for any abnormalities of nodules. And then we're going to check the symmetry of the trachea. And after that, we're going to check on the carotid artery, which is on the neck. We don't want to do both of them because We're not trying to make her fall out. So we're just going to do one at a time. And when it comes to the carotid arteries, we're going to check for any Brught's and venous distension, jugular venous distension. First, we're going to check for abnormality of nodules. No abnormal nodules going on there. So we're going to check the symmetry of the trachea. Symmetrically equal. Now we're going to check the carotid arteries. Pulses +2, strong. And I see no signs of Brught's and no signs of jugular venous distension, which is good. That's a good thing. So we're going to go ahead and chart that. Chart, and chart. Now what we're going to do next is we're going to check for the chest. Now the chest, I'm going to check for any heart or abnormalities, such as arrhythmias, heart arrhythmias, murmurs, things of that nature. So what we're going to do is check for that. Let's see, go ahead and get it in line here. All right. So now how we're going to do this, thank you. How we're going to do this is I'm going to raise you up here just like you already did. And I'm going to start with the aortic, which is right above the clavicle. This is the aortic, pulmonic, herbs, point, tricuspid, mitral, and then right under the left nipple, apical. And we're going to reverse back to the aortic. Everything sounds pretty good. I don't hear any signs of arrhythmias, murmurs. I don't hear any signs of those. No beat skipping, anything of that nature. So what we're going to do, we're going to go ahead and chart that. And now we're going to check for the lungs. We're going to check for the lungs for eventual sounds. Anything such as rhonchi, wheezing, any high-pitched, low-pitched, any crackles. We're going to check anything of those natures real fast. We're going to check all that real quick. Let's go ahead and get it set up real fast here. Excuse me, I'm sorry about that. We're going to check for those. All right, so we're going to first assess, which is going to be the apex. And now we have 10 of them. We have 10 ways. And if you can, just lift for me one more time. Sorry about that. Thank you. All right, so we're going to start. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, all right. And I went a little extra because I believe what I meant to say that it's 14. Now what we're going to do next here, which by the way, no signs of wheezes, no signs of rhonchi, no signs of crackles, no eventuous sounds. So everything's going good right there. So we're going to go ahead and document that on the front side. Now we're going to do the back side, which there's 18. So if you can, if there's any way you could just turn around for me so the camera can see, so we can do 18 sounds. Are you okay with that? Mm-hmm. All right, so we're going to start at the apex again. 1, 2, 3, 4, 5, 6, 7, 8, and so on. 9, 10, 11, 12, All right, again, no signs of crackles, no signs of rhonchi, wheezes, no too high pitch, no too much low pitch. Everything's going pretty good there, so we're going to go ahead and document those. Okay, now we're not done with the lungs yet. We have to do it laterally as well. So what we're going to do is I'm going to start with the left side. I'm sorry, ma'am, may you please sit up one more time? And can you twist the side so the camera can see? So Miss Clark can see. Happy birthday, Miss Clark. All right, may you just raise your arm real fast. All right, now we're going to start from the top. All right, and now we're going to do the right side. All right, everything sounds pretty good. She burped there a little bit, but that's okay. Everything when it comes to the lungs sounds bilaterally equal. Respirations are good. Again, no signs of wheezes, no signs of rhonchi, no signs of any crackles of any nature. So we're going to go ahead and document that. All right, now we're going to do the stomach. So this is where you can lay back a little bit. All right, so now we're going to do the stomach. So now we're going to do the stomach. So the stomach, we're going to check to make sure that there's no hypoactive, no hyperactive sounds going on. Make sure that everything is going the way it's supposed to go. Between 5 and 30 clicks. And make sure the bowels are doing what they're supposed to do. All right, now before we do this, I'm not just gonna go and palpate first. I'm gonna first have to listen to them. Because if I palpate first, that could hurt what I'm trying to assess here. So we're gonna first listen. And what we're going to do is we're going to first start with the lower right quadrant. Lower right quadrant. Upper right quadrant. Upper left quadrant. Lower left quadrant. Everything sounds pretty equal. I don't hear any hypo or hyperactive. Everything sounds normal, regular. Now, ma'am, if you don't mind me asking, when was your last bowel movement?
This morning.
This morning? Okay, does that happen so often? Is that like a normal thing for you? That's not abnormal?
Yes.
Okay, good. All right, now, we're going to go ahead and chart that real fast. No hypo or hyperactive. Chart. Bowel movements. Bowel sounds, regular, normal. Now, I'm not done with the stomach yet. Now, next, I'm going to palpate for it. You know, to make sure I don't feel any masses, make sure no swelling, edema, anything like that. So we're going to start with the right lower quadrant. Now we're at the upper right quadrant. Now we're at the upper left quadrant. Now we're at the lower left quadrant. Did you feel any pain there, ma'am?
No.
No pain. She didn't feel any pain, but we're going to do it again, and we're going to go just a little deeper just to make sure that what she's saying is still what she's trying to say. So we're going to start with lower right quadrant, upper right quadrant, left upper quadrant, left lower quadrant. Do you feel any pain?
No.
Okay, no swelling, no masses, anything of that nature?
No.
Okay, so what she's saying is still true. No signs, no signs of edema, swelling, mass, anything of that nature. Although I did hear a little bowel sound there. So she could be hungry, but we're going to get to that. All right, so let's go ahead and chart. All right, now, before we get to the legs, I would like to first examine your arms and your hands and nails for capillary refill. So if you can, just push it. Yes, thank you. Now, I'm going to do it this way, Miss Clark, so you can see this. Symmetrically equal. I don't feel nothing deformed in that nature. All right, now we're going to check the hands. No signs of clubbing. We're going to do capillary refill. Color came back in 3 seconds, so that's really good. Again, no signs of clubbing. Good capillary refill. No swelling. No signs of cyanosis. No cuts. All right, now we're going to go ahead and chart that real fast. Chart. All right, now we're going to do the same thing for the legs. Now I'm doing it this way, Miss Clark, so you can see that I'm doing it, because if I do it this way, I don't know if you'll be able to see it too good. So I'm going to do it this way. Check for the legs. Hair good and intact. Legs symmetrically equal. No deformities. All right. No cuts, no signs of edema. No signs of cyanotic activity, no blue colors, anything of that nature. Now what I'm going to do is I'm going to check the capillary refill for the toes as well. Capillary refill came back in 3 seconds once again. Now what I'm going to do, Miss Clark, is I'm going to have her press against my hands here. If you can, just go ahead and press your feet against my hands. Thank you. It's the flexion. Good strength. Now, can you do the dorsiflexion for me as well? All right. Thank you. Good strength. I'm going to go ahead and document that. Document. And now, also, what I'm going to have her do that I didn't do before, but I'm going to do now, is I'm going to have her grip my fingers. Okay, strength is good. Thank you. Strength is equal. Document. All right. Now, before I let you go, I do have a couple questions, because there's a couple more things that I want to document. So, a question that I have for you is, bowel movements, stomach is good, right?
Yeah.
Regular bowel sounds, okay, good, because I have here no hypo or hyperactive things going on, abnormalities or masses, if anything, edema. All right, so may I ask also, do you use anything to assist yourself in walking?
I do not.
You do not. Okay, so I'm going to document that. All right, do you use anything to help you with urination?
I do not.
You do not. Okay. Document. Never had a catheter before of anything of that nature, right?
I have not.
All right. No assistive walking devices, anything like that? No, nothing. Okay. Document. All right. And have you? Oh, also, one more question, just to be sure for the books here. Do you use anything to assist you in feeding?
I do not.
Okay. Document. All right. I think that we are just about good to go here. I appreciate your time. Now, before I go, what I'm going to first do is I'm going to wash my hands. I'm going to lift the bed rails back. I'm going to lower the bed to reduce wrist falls. Wash my hands one more time just to be safe. Take away the privacy covers. And I appreciate you. Thank you for your time. Is there anything I can do for you?
No, that would be all.
All right, thank you. Here's your call light. Let me know if you need anything, and I'll come straight away. Thank you. Have a good day. Yes, ma'am.